Your Excellencies, dear colleagues, ladies and gentlemen. In 2015, the Rafiq Hariri University Hospital was in really catastrophic conditions. It faced a very big challenge, and as a public institution, it was the epitome of failure. During the following years, gradually, that institution was turned around. And when COVID-19 arrived in Lebanon, it was in a shape to allow it to be at the forefront of the COVID response and to be able to take over when a lot of university hospitals and private hospitals shied away and stayed away from giving access to needy patients. The obvious question is how? How could we turn around our public institutions? Is it by giving them more resources? Is it by giving them more funds? My experience at that institution tells me that the main problem with a lot of our public institutions is actually governance. And with the right governance, institutions not only can be turned around, but can actually deliver what they are supposed to do to our population. Fast forward 5 years, and we find our country. We find our country not only facing one of the biggest health challenges that the world is facing, but we find it also in the middle of an economic and political storm. And now we also face the same question, and that is, how will we respond? How can we reform our country and make it a success again? At the Ministry of Public Health, when I took over, we faced huge challenges. The needs are and will be in the foreseeable future huge. At the same time, we see that a lot of the resources that we have are very scarce and not enough to address those needs. One of the things that we wanted to do was a digital transformation. And I will give you 3 examples of ongoing projects at the Ministry of Public Health that address our needs. As you know, medications, medical supplies, access to primary health care are things that are badly needed at the moment. However, we face a lot of hoarding, we face a lot of theft, and a lot of the scarce resources we have are not being properly allocated. We have several apps and programs that we were working on at the ministry. One of them, MediTrack, allows us to track medications, precious medications, especially those allocated to cancer patients, from their entry into the country till they are properly allocated to the deserving patients. Another application we have is Supply Trace, which allows us to trace also medical supplies that are being subsidized and make sure that when they reach hospitals, they reach them with the fair price that they should be priced at, and not ask patients to pay exuberant amount of money out of pocket. And the third one is Aman, which allows patients to fill their applications for cancer medications, and then those can be distributed properly. With all of those apps, we had a big problem. We don't have a unique ID program at the ministry, and that allows a lot of fraud, a lot of duplication, and it really hampered the implementation of those programs. That was when we started collaborating with Impact on those projects. Indeed, that was not the first collaboration between the Ministry of Public Health and Impact. We had done it before with vaccination to a great success, as we all know and as we have heard. But working on those 3 projects with Impact, and I was personally very involved in those, allowed me to learn a lot of lessons. And those are some of the lessons that we are here to listen to. And that is how can we improve the governance of our public sector, and how can we improve the conditions in our country. And I will not burden you with a lot of what I have personally learned, but I want to mention few things that I think are very important. First is that reform is not a sprint, it is a marathon. It is something where the word endurance, hardship are very important. It is very time consuming, and really it is something that will take a lot of effort on everyone's behalf. And the trajectory of reform is not a straight line. Sometimes you have to take steps backward to be able to move forward. And sometimes, and unfortunately nowadays, a lot of the times, things do not go as you planned. But the important thing is that we should not give up, and that we go back and put the effort to go where we want. What is important, finally, about what I have learned is that it is never about the resources, the materialistic resources. It's always about people. And if you have the right people with you, then a lot can be achieved. Working with the Impact family, as I have discovered, and they are a family, with CSI, with Carol, and with Judge Atiyi, and Danny, and the rest of the guys, what I have found is a group who are determined, resourceful, and very dedicated. A group who could easily, with what they know, could find a job outside the country where they will live a very comfortable life and make much, much more than they are doing now. And for me, it is, and I hope will continue to be, a privilege working with them and putting the effort to achieve as much as we can a reform of the current situation. At the end, I want to tell you something. We are on a journey, and I cannot promise that we will reach the destination that we all want to go. I know that it is going to be a long and a hard road ahead of us. But what I can say is that working with Impact will really make this a more tolerable journey. Thank you.